This is a question that I would like all of you to ask yourselves and try to answer that in your mind. I'm gonna start saying certain things that my patients say: headache, like hot flashes, and dizziness. Well, what do I have to say about that? I would say no, no, and no. That's false. And I want you to understand something. It's not that if you are hypertensive, you cannot have a headache. Of course. But definitely those are not the typical symptoms, or that is not something you should expect for you to know that you have hypertension. Usually, the most common thing you're going to find with hypertensive patients is nothing. Remember, I titled my seminar, my webinar, The Silent Killer. And that is something that I like to explain to my patients. And I think it's one of the most difficult things we have with high blood pressure, because it is difficult to fight something that is so silent, especially because uh, for the patient, it's difficult to accept treatment for something they are not feeling. So if your car is not making any noise, it's not leaking anything, if your car runs perfectly, probably you're not going to take it to the shop or to the mechanic. But probably something might be happening, and in this case, it's something very similar.